Good evening, ladies and gentlemen. This evening we've got the Health and Wellbeing Board, which I am chairing. Dr. Nina Pearson, I'm Vice Chair of the Health and Wellbeing Board. Hazel Simmons is on leave this week. And it's good that we could come together. Those on screen, are you able to hear? Yeah, good, thank you very much. And hopefully those in the chamber as well can hear. And I'm hoping that Bert will keep me on task and ensure the governance is correctly dealt with. As we start this meeting, there are some points to share with you. So I will just read my instruction leaflet here and ensure that we're all clear on the instructions. So this is being live streamed to the public this evening. A recording of the meeting will be available on the Council's website within 24 hours of the meeting. Please will you wear your face masks on entry into the building and the meeting room, but you may take them off when you're seated. And please can you also scan the QR NHS COVID app poster on the entrance here or as you leave if you haven't done so already. You've got the ability to turn on your microphones when speaking. As I say, if people can't hear, please wave and we'll give an opportunity for repositioning so that we can hear the proceedings and their microphones off afterwards. If you're on screen, can you use the hand icon to indicate if you want to make comments or make questions? And it'd be good to be continually seeing people if possible, please. Mobile phones on silent, which I will do now myself. And let's move to any apologies for absence, please, Bert.
Yes, Chair, we have apologies from Councillors Simmons, Tamina Salim, Felicity Cox, and Lucy Nicholson. And Chair, we have, as you can see, a number of people joining us virtually. Thank you.
Thank you very much. If we move to the minutes of the last meeting, which we take by order. So any amendments or any clarifications, then please do indicate. So page 1, page 2, 3, 4, and 5. So I take it I can sign those as a correct record of the meeting. Thank you. Any disclosures of interest, please, by members? No, thank you. Any urgent business, please, Bert?
None, Chair.
Thank you very much. Any references from committees or bodies?
None, Chair.
Thank you very much. So we'll move then to item 6 on the agenda, which is our regular update on COVID-19. Sally, you will also give us an update on other work that's going on with the public health agenda. That's right.
Yes. Thank you.
So as people speak, as you give your reports, can you please give your title so that people know who you are? So thank you very much.
Thank you. So I'm Sally Cartwright, Interim Director of Public Health. So the update, the regular update on COVID situation was included in the papers, but I've got some more recent data to share and a more recent update on actions to tackle COVID in the borough. So our rates as of today are 313 per 100,000 cases, 313 cases per 100,000 in the population. Which is now slightly above the East of England and England average, which is a bit of a shift in the last 3 weeks from being below those averages, and we're now just skirting above. The highest numbers of cases at the moment are in the 20 to 29 age group, but we're also seeing a gradual increase in older ages. We are seeing cases at the moment in care homes, which we haven't seen for a while during this period of the pandemic. So it is a bit worrying that we're now seeing some small numbers in care homes in the borough. As a response to COVID, we're looking at the actions that are needed in preparation of going back to school. So the team are looking at supporting schools in preschool testing. So all secondary school children will need to be tested before they return to school. So schools are managing that themselves, but we can offer support and guidance where needed. We're also looking a lot, working with the CCG around the vaccination uptake and trying to increase vaccinations in the borough. In Luton, we do still have lower than desired vaccination uptake rates. So we're doing a lot of work looking at ways of improving that and outreach to the community. So some of the schemes that we've got at the moment, you might have seen promotion around a taxi offer to help people get to appointments or to the walk-in sites. So if people are struggling with transport, there's a free taxi service that they can call upon that we're promoting across the borough. We've also got some support from the national team coming up in the next few weeks in talking to people, so knocking on doors, having conversations about the vaccine across certain target wards. So we're looking at initially targeting that in South Ward and Dallow Ward, where we know we have particularly low uptake, just to have conversations with people to try and encourage vaccination and direct to sites where people can be vaccinated. So in the first week, we'll be promoting the taxi and encouraging walk-ins to the Farley Vaccination Centre. And in the second week, we'll have a bus at a really close location so that people can go and be vaccinated there and then. There's obviously in the guidance more recently, there's been changes to the advice if you are a close contact of a case of COVID. So if you have 2 vaccinations now, there is no need to isolate, but you do need to get a PCR test prior to being released from isolation. So we are expecting the PCR testing sites to still be quite busy across the borough. But in terms of the rapid test sites, we are seeing numbers in the rapid testing locations still remaining quite stable. So lots of people are still picking up the rapid tests and getting tested at home. But we are seeing a decline in the numbers of supervised tests. So you could determine from that people are used to testing now and know what they're doing and are happy to take the tests home and test in their own home and use them as twice weekly testing. So those are the main updates on COVID. I'm happy to take any questions. And then I do have some slides to go through, but my computer has just lost connection. So I'll be clicking on that while people can ask me some questions.
So are there any comments or questions from members? Yes, Javed.
Javed Hussain, portfolio holder for adults. The question, these increasing number obviously is worrying 313. Do we know if any of these people, do we check to see or ask the question, had they been out of the country in the last month or so? Are we gathering that data?
On cases, sorry. So it's not asked on the cases, but people that are travelling back are tested on return, so they will be picked up through that route.
I was thinking, what if there's any latent, if they picked it up latent, it would be interesting to know that. I know that because some countries now, if they don't need to isolate, they can go back after the PCS, they can go. It'd be interesting to know if any of them are after 7 days or 10 days are then starting to show latent symptoms, and it may be worth looking at that, asking that question.
Yeah, I can take that away and have a look at that. Thank you.
So Phil next, and then Dr. Malik.
Do we know why we suddenly got some we've got some care home? No, I asked the question because out of Luton Borough, my family over in Leighton Buzzard, they've got some in care home as well, and I'm just wondering if there's any reason for it that you know.
I don't know actually. Unfortunately, it's quite unfortunate and quite surprising, and we have recently had a meeting this week to look at the outbreaks and look at all the measures that are in place and review and check that people are all still doing all the right actions. And we've had an outbreak management team specifically to look at care homes and go through with the care home the actions that they have in place, check that they've got PPE, check that their infection control measures are still in place. And there's nothing specific that we've picked up through those conversations that we can pinpoint. So I don't really have an answer apart from increasing rates and the Delta virus being that bit more infectious. That we're at a point now where there's enough circulating that it's entering into the care homes again. I don't know specifically. I do know that we are doing a lot of work, again, looking at vaccination rates in care homes and working with the managers of care homes to work through increasing uptake of vaccination in their staff. A very high proportion of residents in care homes are vaccinated, but there are still a substantial number of staff that aren't, that we're working with the managers to try and increase. And obviously, we know that there's mandatory vaccination for care home staff coming in due course, and the deadline for that is in the next couple of months. But the deadline to meet that timeline that they will have needed to have their first vaccination by is towards the end of September. So we're working hard with care homes to try and make sure that there's the right opportunities for people to get vaccinated prior to that date.
I'll come to a second to Councillor Malik, but just to build on the care home, I'm glad you asked that question, because I was going to ask for, do we know any more about this? My awareness was raised more this week because of a meeting I was in where it's not just the people who work in care homes, but anyone, the contractor, GPs, nursing staff, will need to be double vaccinated in order to go in. So just for your awareness that it is more than just the staff who are working within that environment. So I think efforts are really being made to try and keep it as safe as possible in terms of transmission, but there may be some lessons we can learn from this, but it may be, as you say, that it's a fact of life and the prevalence that we might have to get used to.
Is it anything? I know the case I know out of Borough is with a couple that had been doing a lot of going out and socialising type thing. Those two sort of got it. I think they sort of felt as restrictions were eased, they were able to do that, and they caught it and brought it back into not actually a care home, it's a elderly residential area. And I'm just wondering if maybe there are people in care homes that are getting out more and bringing it back in.
That might be a factor, and care homes are having more visitors come in now. You'll remember this time last year there were no visitors at all allowed in care homes, which had its own problems, and people in care homes are very isolated, and it was really challenging. So there is a balance that's needed between visitors and allowing visits out and infection control. So I'm hoping we don't get to the point where that has to be stopped again. And there's so many cases in care homes that nationally there'll be more guidance coming out about visiting. I'm hoping that's not the case, but it is a balance.
Thank you. So set up a watching brief on care homes. Thank you. Councillor Malik.
Thank you. Khadija Malik, portfolio holder for public health. It's quite concerning that the increase in rates is going up and around care homes, etc. But I think most recently I'm hearing around many, obviously people are allowed to attend weddings, large gatherings. And how is it that we're able to speak to some of these places in order to contain some of this? Because I've known of people that are double vaccinated are getting the virus, and the spread of it is so much more. Speaking to people that attended a wedding that I know of and going away, and then still seeing some people that are in contact there still out and not isolating before even Monday's announcement this week, was quite concerning for me, that a large number had actually caught the virus from this event and then were not isolating, because I came across them, and then when I'd heard they'd been there, I sort of jumped back. So it's quite worrying that, yes, they're not legally doing anything wrong, but the spread isn't going to go down if we really aren't going to be proactive in making and ensuring that if we've been somewhere, it's really difficult if the whole family's going to an event and you're having to isolate because the night before you've just been told you're positive and everybody else that's been around you thinks, I'm not positive, so I'll just go anyway. They don't have the symptoms, they're not testing, and then they're attending and then spreading. And that was quite concerning for me. So I know that we locally can't do anything. It's a national thing and it's the government that's making these decisions. But I think if we're going to open up, the schools are going to be opening up in September, we're just going to have the virus just spreading. So is there anything locally messaging or anything that we can do to work with people around isolating and testing more so that it doesn't spread?
Yeah, I think it's a really good point. I know the communications team are doing lots of work still on promoting the messages about if you have symptoms or you've tested positive, isolate, and that hasn't gone away. But obviously the contact of cases, the guidance for that has changed. But the messaging does still need to be that the virus hasn't gone away, and we all still need to be following hands, face and space where possible. And still being sensible and still being concerned about the virus. So it is a really difficult balance. And I think we are continuing to work through how we communicate the right messages.
Thank you. So I guess
Thank you. Just a supplementary question. Just building on, so I guess this comes around about, I was going to ask the question about best practices, whether we send some of our environmental health out to shops and say, look, best practice, carry on with using masks, carry on washing, so that, because obviously the numbers are going up and they're going up worryingly. Maybe we need to do a bit more with our businesses, do a bit more re-education, just to say, but even though we can't legally force them, but just tell them what best practice, protect them, protect their families and protect our population. And the second one of the question was, is it predominantly in residential homes and nursing homes that the numbers are going up? Do you have that breakdown, or is it not known?
I don't have that breakdown actually in front of me. I can have a look and get back to you. Yes, I am. Yes, thank you. Just test this dual way of doing it, so bear with me. There you go. Just trying to maximize my screen, sorry. Okay. So I just thought I would also give an update on the Population Wellbeing Recovery Roadmap that came to Health and Wellbeing Board a few months ago, I think, just to highlight some of the work that's happening as part of recovery, rather than just the acute response that we tend to discuss when we have the COVID presentation from the Director of Public Health. So this was the plan that you will have all seen and that we signed off in a previous meeting around. So the first green column is about the response, which is some of what we've just talked about, thinking about the national response and the local response. And then the subsequent arrows and boxes are around recovery and reset. So I know it's very small on the screen at the moment, you won't be able to see that all. But I wanted to talk through a bit around what we're doing about recovery and reset, which a lot of it is very much work in progress and partnership working, and will be a long-term area of work. But I wanted to highlight some of the work that's ongoing. So just thinking about recovery, first of all, so one of the boxes there in that first diagram that I showed is around tackling inequalities. So we know that nationally and locally, we are seeing inequalities through the impact of COVID, and concerns about the impacts of COVID widening inequalities that have already been seen, both for us in Luton and nationally. There's a lot of work happening around this. So just to highlight some of the things that are happening locally to address some of these issues. So in the Inequalities Delivery Board paper a bit later on, I'll talk through the project Talk, Listen, Change, where we've commissioned the University of Bedfordshire to look at the impact of COVID on certain ethnic groups that we saw were disproportionately impacted by COVID during the first wave. So the findings of that have now come out. We're just waiting for the final report, which I'll share once it comes out. But we're looking at developing a very clear action plan responding to those findings, and working with the community to develop some change and some actions that can be taken forward based on that. So we're in the planning phase for an event to feed back to the community and collaborate to co-produce some solutions. We're also using our Contain Outbreak Management Fund to develop some community-led initiatives to tackle inequalities, building on COVID, but also working with the Fairness Task Force and the voluntary sector to develop some of that work. We are starting to work with the University College London to develop what's called Marmot Principles, which Sir Michael Marmot has published extensively on inequalities, and has published a report called Building Back Fairer, looking at the impact of COVID on inequalities. So we're hoping to work with the team there to look at what that means for Luton and develop Luton to be a Marmot town. So that's in early stages of development, but would be really exciting if we can take that forward and could really have an impact on some of this work. We've also been looking at inequalities-based data to look at vaccination uptake and address this through outreach. So really trying to target where there's lower uptake and lower uptake in certain groups of the population. So having a really intelligence-led approach to that. Some of the learnings from COVID. So just to highlight some of the key bits of work that are impacting on this area. So looking at the COVID Champions programme, which you should all know about, that has been really, really important and helpful throughout the pandemic. So we're looking at now what that should look like going forward. So using the insights gained from that approach to further develop the model to tackle community issues and think about COVID and other wider health areas. Working with Healthwatch to build on the insights from their work into our work programmes and how we can work collaboratively on some of that. Continuing to work with our faith and community leaders as we have been throughout the pandemic and building on that work and those relationships. I've mentioned the Fairness Task Force and working collaboratively with that to look at a fair and socially just society in Luton. Responding to the insight of our providers around the best approach to service delivery. So we know that in some of our providers, the telephone service that they've had to pick up through COVID has been really helpful, and we want to continue to do that. So taking those learnings of where there's been benefits in the services and building on those going forward. And then thinking about what we've learned from how we communicate during the pandemic. So what works to communicate to the community, using mixed approaches and being what's the word? Consistent in how we communicate. So we've been doing that for vaccination outreach and promotion, and for the work we've got at the moment around Luton Let's Get Active campaign to try and increase physical activity as we come out of COVID, and a new project on the Good Gym and the way we've communicated the launch of that to the public. So there's some particular areas that have been through the pandemic are now seeing increasing demand and increasing health needs in the population. So doing some work to look at how we address those and that increasing demand and that increasing need. So the CCG are leading a mental health strategy that we are contributing to, and we've completed a needs assessment which has come to this group previously, looking at where there's particularly high need around mental health in the community. We continue to lead on the suicide prevention group across Bedfordshire. In the mental health services, there's a mental health improvement plan to work to reduce demand on mental health social care, and looking at building a greater focus on prevention into pathways. We've got a physical activity strategy that we're refreshing, and I intend for that to come to a future health and wellbeing board, but building on the reduction in physical activity that has been seen through COVID and trying to improve on that. We've got a clear plan to deliver against the domestic abuse strategy. So we know that domestic abuse has seen an increase through COVID and needs some really targeted and focused work now. So we're working hard in collaboration with the children's services around developing the actions against that strategy. And we're working closely with the Drug and Alcohol Service to develop their COVID recovery plans and have a particular resource in addition through grants such as the Rough Sleeper grant. And then building on the Everyone In programme, finding emergency accommodation for people that have been rough sleeping or at an imminent risk of rough sleeping. So that's been a really successful area of work as well. A lot of work happening around education recovery. So, for example, work's underway to look at digital inequalities in school settings. We are continuing as a team to work with schools to provide COVID outbreak support and guidance to try and limit the impact on school and education. So towards the end of last term, there was a lot of concern about the disruption to schools through COVID and lots of people going off as bubbles got shut. And so there's a lot of work to try and limit the impact that has had going forward. Summer schools offers across Luton to focus on catch-up. Focusing on transition between primary and secondary school where that wasn't in place last year, and looking to build that back in a more in a stronger way for going forward. Looking at some of the mental health impacts on school-aged children as well throughout the pandemic. So there's a lot of work happening with emotional wellbeing in schools. So Cooth is an online counselling service for school-aged children, which is being developed in Luton now as well, and thinking about the impact on young carers through COVID as part of the carers strategy. And then just a quick summary whiz through some of the actions that we laid out in the reset, which is the building back healthier element of the recovery plan. So some areas about embedding best practice, so things that we've had to do differently through COVID, such as the discharge to assess pathway. So looking at what that means now going forward and how we build in some of the learnings from that. The inequalities work I've talked about, but it's hugely important and will continue to be of great importance for us as we continue. And in focus on the wider determinants of health also I've talked about around the Marmot approach, and also health in all policies, so thinking about the public health and health impacts across all that the council and partners are doing. So trying to work through a strategic approach to that work. Looking at the impact on the market, so thinking about the housing and social care market. So there's a piece of work at the moment looking at commissioning approaches in light of COVID impact and pressures on the market to look at different models. Looking at strengthening and the health and social care workforce, so thinking about there's a national initiative, Skills for Care, and the impact of the social care workforce through the pandemic. Lots of work around supporting children and young people's pathways into training and employment. So there's the development of the Luton Employment and Skills Framework, apprenticeship schemes, and working with schools and colleges to raise awareness of careers and opportunities. So there's lots of work in that areas. I've talked a bit about taking services to where people are and learning from COVID in terms of the impact of different services, thinking about community testing, going to community locations where people are to take things to the people rather than expecting if you build it, they'll come to us. So trying to take the learnings from some of that through COVID as well. And then lastly, and really importantly, supporting the development of our own workforce. So in public health, we're very involved in the employee wellness plan to address physical and mental wellbeing of staff. There's some work happening at the moment to think about inclusion of staff that aren't office-based and how we communicate to those staff that are out and about and not on their emails all the time. And then a lot of work from the HR team around the new normal and how we bring staff back into the workplace safely. And I think that's the last of my slides. So happy to take any questions, but I thought it was useful just to run through where we are with some of that we laid out, some of what we laid out we were going to achieve previously, just to update you all on progress against that.
Thank you, Sally, and thank you to your team with the enormous work that's going on. And obviously it's matrix working across all the teams as well. So I can see progress and plans. So can we take any questions or comments from colleagues for Sally? Thank you, Councillor Singh.
Thank you. Sally, thank you for a comprehensive report. I think that's wonderful. There's a lot of great stuff in there. The only thing I would say is that when we set the goals, let's make sure they're smart goals that we can measure, that they're deliverable and they're measurable, so that when we do come to analyse them, we can, they're smart goals, so that we can really see where we are today and where we are in the future going forward.
Yeah, absolutely. Thank you.
Thank you. And there are some metrics already, and presumably there's some more work in progress on that.
Yeah, absolutely. And we'll be developing the metrics as part of our wider population wellbeing strategy and have some clear KPIs in that. But this will form part of that, and we need to be able to be clear which bits are relevant to COVID recovery and the impacts of COVID through that. So yeah, absolutely.
I can't see any other hands up at the moment, so I'm going to take a bit of space. Really interested in the Marmot Principles and the working with UCL and how that might, I'm sure will actually inform our ways of working in the health sector, primary care networks. I'm quite heavily involved in the population health work as well, and we were having some conversations this week about where to focus our efforts in Luton to have greatest impact. So obviously we will be using including public health in that. But I think thinking about once you've got some tangible work that you can share, how do we do that with our wider workforce? Because I think if they all get the ideas and the principles, they will see other areas where they need to implement that, as well as what's obvious that we tell them about. So I would encourage that when it's ready. What kind of timescale are you thinking?
Yeah, absolutely. And I would welcome that. We're really early days with that work at the moment. We're just in discussions with UCL about what that would look like and the timeline of their involvement and who needs. We haven't even set up, the first get going meeting yet. So really early days, but would absolutely want your involvement in that. Yeah.
Sorry, Amanda. Go ahead.
Thank you. Amanda Lewis, the Director of Children's Services. Sally, just picking up on the kind of impact of the market and relating to social care and housing. I'm just thinking how important it is that we give consideration to, and I'm sure that it is. I'm just testing the whole approach for children's social care, children's placements, and the significant work that's underway in relation to the case for change that Josh McAllister is leading on nationally, and the work of the Market and Competitions Authority that have been instigated to investigate and give consideration to how public funds are being used in children's placements and the monetarisation of children's social care placements, given the significant pressure and lack of sufficiency that is now a national and growing issue. So I'm just thinking, when we're thinking about that kind of integration across the system, because your briefing, I think, was really, really helpful in bringing all of those threads together, that we hold that thread as part of managing the market, both locally, regionally and nationally. It may be something that the Health and Wellbeing Board wants to come back on if it drills down on those key areas. Thank you.
Yeah, I think it would be helpful to bring something back at a later date on some of that, because Laura and Maud may want to come in, because they're probably a bit closer to this work at the moment than I am. But at the moment, that market analysis and commissioning approaches work is just looking at adults, but there obviously is that transition piece as well. But I think it would probably be useful to bring something back here at a later date on some of that.
So I'm seeing nods from Laura and Maud. And any contribution you'd like to make at the moment as to how, what timeline are we looking at? How far into that piece of work are we?
In relation to adult social care, we are looking at developing a new adult social care strategy, which we will want to engage with the Health and Wellbeing Board and scrutiny on. We are at early stages on that, and we'll come back with a timeline, but we definitely want to bring that back, and that will look at the market and some of the challenges that we're seeing in the market at the moment, and also not so much in the point Amanda has raised about the looking at the children's care market, but you've got some of the same issues arising about the business element of how that operates. But so I think Maud will be bringing that back before Christmas, won't we? And Jarvid.
So I think we will welcome that, and I think people have an awareness that there is some fragility. We maybe are not as cognizant of how fragile the market might be. So very timely, and I'm sure we will keep us updated if there are any significant risks that we need to know about. Thank you. Any other comments or questions?
So just to reassure you that it's one of the discussions every week. We always talk about the fragility of the market. It's one of the discussions every time in my meeting with our adult social care team. Yeah, it's one that we watch every minute, and we're always concerned. I can assure you that we are watching it very closely.
So thank you very much. I wasn't doubting it. It was just maybe some of us don't think about it enough. So thank you.
I think it would be a very helpful topic to debate. And I think it's also something that we are keeping a very close eye on, and it's in and lots of other areas are impacted by this at the moment, and so we are it's been discussed in lots of places, but it would be a really good theme to come back to, and also about how wider partners can support. Particularly within the integrated care system around the skills development, our links to the university, on developing the sector as well. So some interesting work which will come through the adult social care strategy, but also some of the other work that's going on as part of the integrated care system.
Thank you. Then we look forward to that. So I'll draw a close there. This was an information item, so thank you very much for that, Sally, and both the inputs there. We now move on to item 7, which is a section 75 agreement for 21-22, and is that Maud who's giving that piece? Is that Laura or Maud who's giving that one?
I'm not sure actually. We're looking at each other.
Sorry. Or is it who's on there? Is it
Kate Sutherland should have joined us remotely. Yes.
Okay. Has she flashed off again? Might have disconnected. Shall we watch the screen and see when she reappears? She's not on there at the moment, is she?
Chair, do you want to pause while I check?
Yes, we'll keep moving and come back then to that. So Children's Trust Board, there is no update from the last meeting. We've not met again, so that is fine. And the it'll now be called the Place Board, not the Transformation Board, I think, Laura, won't it?
It will be.
So again, we've not met for that one. I was trying to give you a rest, Sally, but it looks like you've got Health Inequalities Delivery Board then pending Kate coming online. So can we do that?
Yeah, no problem. So some of what I will talk about now, we've just covered a bit in some of the inequalities discussion in the COVID recovery plan update. But I'll just talk through the report and highlight some of the key areas of that. So in the last meeting, we had a big discussion about the Talk, Listen, Change project and some of the findings that are starting to come out of that, and think about the next stages. We're also looking at reviewing the terms of reference of the group slightly so that it's still relevant and that we incorporate some of the wider determinants of health, and really looking at why health and inequalities are relevant to others across the system. I think, as quite often happens with groups that have been around for a long time, it just sometimes needs a bit of reinvigorating. So we are doing a bit of a focus session in the next meeting to pull together wider partners and refocus on what the purposes of the group is, and try and engage that bit more around some of the topics. So on that basis, we're revising the terms of reference, and they're attached to this report as well. So in terms of the University of Bedfordshire Work, Talk, Listen, Change, as I mentioned earlier, we're looking at the next step will be a community event later in September to feed back the findings and try and start to co-produce some of the solutions to the issues raised by the findings. So part of the project was that the University of Bedfordshire led was engaging with community researchers that helped with the actual implementation of the research. So they were trained up by the university and conducted focus groups themselves. And we want to continue to make sure that those people are really engaged with some of this work and can help us to continue to communicate with the community. So we'll be including them in the event and working with people to try and think about what the findings mean and how we can take some of that forward. Some of the points particularly that we want to talk about in that meeting is around physical activity and the impact of COVID on physical activity and accessibility of physical activity options for people. There was quite a lot that came out about the importance of family and how we can use that to communicate messages to people in the community and thinking about the influence that family has across the community. Some of the discussions were around access to health and care and the impact that has on people. So there's quite a lot of in-depth findings that we'll be working through and doing trying to work through as you said. Now we're taking this forward and develop that into a really clear action plan. In the meeting, we also looked at the impact on the pandemic on the voluntary sector. So there's a sort of subgroup looking at this and working up what actions we need to have in place based on this. So during the pandemic, the voluntary sector have been quite substantially affected, and some organisations have stopped running or have had to shift or have lost their funding. So we're trying to look at what that means for the community and for that sector. And there's quite a lot of streams of work that will be addressing some of those issues, and that will come through to be continuously monitored through this group as well in the Inequalities Board. And we also had a discussion, it's not in this paper, but we also had a discussion about stop smoking services and tobacco control, and looking at revamping the tobacco partnership group for Luton, and discussions around re-engaging wider partners on that group as well, and having a different chair to keep the focus on that area of work. In Luton, we are still seeing particularly high rates of smoking and not seeing a decline in those rates either. So we really still need to be tackling smoking in Luton, and we have had the success recently of the smoke-free malls, which is great. So we need to be building on some of that wider work as well in the tobacco control arena. Thank you.
Thank you, Sally. Just picking up on the smoking aspect of things there. You're saying that rates are not falling as one might have liked, and it's difficult. I think there's also the change in the population to be aware of, and we've been feeling under pressure in my practice and new registrations, and it turned out we'd registered 800 people in the previous month, which is huge. And a significant number of those, at least 25% of those, had never had access to the NHS before. So they're coming from elsewhere. Their behaviours, will be influenced with what they'd experienced before, and also, we're trying to put together what's happening from what we can piece together from their healthcare in the past. So I guess the churn contributes to those sort of denominator and numerator figures, doesn't it, really?
Yeah, absolutely.
Yeah.
And I think that's one of the challenges in Luton as a borough as well, isn't it, that we do have quite a lot of churn. That means that you'll get a certain cohort to stop smoking, then another lot come in, and it's not that stable population that other areas might have. Emily.
Sorry, I'm off mic. Any other comments?
Chair, I think we have had a look at churn within the population and got the council's business intelligence team to do some work around that using information from national insurance registrations and roles within schools. We think that would be a good piece of research to refresh, just to see what's happening and what the impacts of Brexit and COVID have been on that. So that's the piece of work we will be commissioning.
Thank you. Sounds very timely. So I'm not seeing any hands up, no other comments here. So we are asked today to note the updated terms of reference and to note the plans for the next steps for the Talk, Listen, Change project and to receive the summary. So I don't see any disagreement around the room there. So thank you very much. Those recommendations are taken. Thank you. Now then.
I'm going to take it.
Well done. Thank you, Laura. You're taking the section 75. Thank you.
Yes, so I think the report is quite clear that we are looking at a single year section 75 agreement, given the changes that will be happening within the and the creation of the integrated care system. So work has been done to update the agreement, and this is the formal sign off of health and wellbeing board before you give Nikki and myself permission to sign it off. It has gone through quite a lot of discussion and debate to get all of the schedules right, and you'll see that it covers quite a lot of areas. It has a good focus on children and young people, integrated commissioning around mental health and wellbeing, mental health, the Better Care Fund, any joint commissioning arrangements and joint posts, and is very clear about our links to through to the CCG. So I support the recommendation and ask you to support the recommendations.
And are we all happy to do so? Can you nod your heads or indicate that you are happy? I'm seeing that on screen and some other faces going on screen. Thank you very much. It's very significant sums of money, as I reminded myself. So thank you, and a very important piece of work to sign off. I'm just juggling papers here. No. Here we go. So the work programme, would you like to, we've got something scheduled for our programme. We were seeking last time other recommendations for things to go into the programme of work. Laura, are you, so this is the corporate director, so this is your one, yes? Any other comments, is it yours?
Chair, you have the advantage of me in that I too can't access.
This is the opportunity for us to look at what's scheduled and see if there are any gaps and anything that we should be including, I think. Our next meeting would be October.
Chair, I think the important issues here are that we're bringing back some of the work that Sally's been talking about around the where we're going with the JSNA and assessment of statistical analysis and the population wellbeing strategy, which we think should be a strong partnership document and is being updated in line with what's happened with COVID. So although you've only signed it off about 18 months ago, we think it's due an update to be really focused on some of the work that we've talked about here tonight.
Thank you. So anyone want to raise anything that they think needs to come back sooner? And in terms of the forward planning? No, in which case we will take, sorry, yes, Sally, go ahead.
Sorry, it's not another item, but just to highlight, my name is down against the employment and skills strategy, which I don't think it should be.
So can I ask that officers take that offline and just tidy up the agenda and feel confident that your timelines for having something meaningful to bring to Health and Wellbeing Board are correct. We will leave that with you, if that's okay. Thank you. So I think we are now at any other business anybody wants to raise? In which case, I will close the meeting. Thank you very much for your attendance and have a good